that, why do we have a monopoly? Right? So Obamacare, or the Affordable Care Act, which is known as Obamacare, gives financial and regulatory incentives to consolidate. They call it, quote, to integrate across the continuum of care. So doctors, clinics, hospitals, especially hospitals, pharmaceutical companies, and insurance companies are given incentives to consolidate, because the argument was, according to the architects of Obamacare, that this would cut costs and streamline care. Of course, it hasn't done that, because by design, monopolies, as everyone has talked about, decreases competition, and that affects quality and increases prices. So how has it affected Vermonters? Well, healthcare costs are through the roof. Right? The same thing with well, 2/3 of Americans get insurance, health insurance, through their employers, whereas and then the rest is in the individual market. In Vermont, the individual and small group markets are merged, and in that, Blue Cross Blue Shield has a 90% monopoly, and MVP of Albany, New York, is 10%. And we see annual double-digit increases in the premiums. The same reason why. It's because it's a monopoly. But the thing is, it's designed, though. You know, it's not as if, oh, why isn't there no competition? There used to be more insurance companies. They all left. That's because Vermont, the legislature, imposes the strictest regulations when it comes to how to price premiums, for example. The whole thing about Obamacare, if we get into that, is a misunderstanding of what is health insurance. Health insurance, just like any insurance, is a business of risk prediction. Right? In health insurance, we pay small periodic payments to protect ourselves from future catastrophe, some unforeseen event that will cost a lot of money. That's the whole point of health insurance. Now, human beings are not cars, I understand that, but just for the sake of an analogy, when we have car insurance, it's not for oil changes. When we have homeowners insurance, it's not for changing light bulbs, right? That's routine maintenance, that's different. So in the same way, when you're deciding on a premium, you've got to look at the risk. That's called a risk rating. And Obamacare changed that, made insurance comprehensive health coverage. So now you have 10 benefits that every plan must have. Otherwise, they call it junk insurance. So a 22-year-old guy has to now buy a plan that has maternity care. Why would he want to do that? All these things cause premiums to increase. And another point, it's sort of technical, but it's important to understand, and that is moving from a risk rating to something called a community rating, where if I'm the insurance company and I have to decide the premiums, I can't do it on the base of risk. I have to do it on the base of like age and health and other factors. So Obamacare made it a rule to say that, let's say if there's a 20-year-old and a 60-year-old, and I'm gonna decide the premiums. The difference from the highest to the lowest premium the ratio can't be more than 3:1. So you limit that. But in Vermont, it is 1:1. A community rating 1:1. So as an insurance company, if I can't differentiate my premiums between a 20-year-old and a 60-year-old, how can I, obviously a 60-year-old on average is going to consume more health services. So that's why everyone's left. So you see, people always talk about, oh, well, why don't we have more people? Well, we do have more people, but the way that the system is designed with Vermont Health Exchange, that's the name, right? The Vermont Health Connect, Vermont Health Connect, the name of our exchange. The way that it's designed, the way that the rules have been imposed, along with Obamacare, it's for consolidation, for monopolies. I always say this, it's a difference between serving ideology versus serving individuals. If you wanted to serve individuals, there are many ways to, purchase insurance across state lines. Whatever you think of the Trump administration, last year they gave exit ramps from this clogged highway. So there's association health plans, short-term, limited duration plans, just plans for catastrophic events. There's so many ways to get the premiums down. There's so many ways to have individual practices and have little clinics so that people have choice and option. But Obamacare and the way the system is created incentivizes UVM to buy up all the practices in the Northwest, and now it's coming down to southern Vermont, my neck of the woods. The system is designed to do that. That's what happens.
So were the off ramps that you just referred to?
Yeah.
Are they not available to Vermont?
Yeah, they're not available. They're available to all Americans, but not to Vermont.